If you and your medical staff want to stay out of medical legal trouble, you may want to continue to watch the rest of this video. In this video, I'm going to discuss something that happens almost every single day in our practices, and it's something that it is very easy for you to get into medical legal liability issues. So for those of you who don't know me, my name is John Lin. I'm a urologist here in Gilbert, Arizona. I work at Sunrise Urology. This video is being live streamed to the Thriving Urology Practice Facebook group and on YouTube. As always, if you have any questions or comments, please feel free to leave them below. Okay, I practice in Arizona. I have a lot of patients who travel from different parts of the country, and then they winter here. We call them snowbirds, also known as the other white meat. Yes. All joking aside, when these patients travel here, I may take care of them, say for their enlarged prostate issues. I may prescribe medication for them. And then they may travel to, I don't know, take a cruise somewhere, or they may fly down to Florida to visit their family. Often, my staff will take a phone call from one of these patients, and they will say, "Hey, doc, can you refill my tamsulosin, for instance, medication for enlarged prostate?" Now, you may be thinking, well, I took care of the patient here in Arizona, and now he is in Florida visiting somebody. Why can't I just go ahead and electronically prescribe that medication to him in Florida? Well, unless you have a license to practice medicine in Florida, you just may have breached legal issues, meaning you may be practicing medicine without a license in Florida. That is correct. Same thing with a lady. Say, for instance, you took care of a lady for bladder infections or recurrent bladder infections. Maybe you prescribed her antibiotics that she can self-start. I call it intermittent self-start therapy. You prescribed her, like, say, I don't know, sulfa antibiotic, 3-day courses, 11 refills. You prescribed that to her. You took care of her while she's in Arizona, where you have a licensed practice, where you have medical malpractice insurance coverage. Now she's vacationing somewhere, say in Hawaii, and she has a urinary tract infection. She calls the office. Your staff takes the phone call and sends you the message. "Dr. Lin, the patient is in Hawaii and wants a refill on her prescription, her antibiotic to treat her urinary tract infection." If you were to prescribe that antibiotic to a pharmacy in Hawaii where you don't have a license to practice, nor do you have medical malpractice insurance to cover you in case of something bad that were to happen with this lady when she takes the antibiotic, you would have no legs to stand on. Meaning, if a lawsuit is brought against you, you would simply open up your wallet and say, "How much?" That is correct. It is that crazy. Unless you have a license to practice in the state where the patient is located, if you treat that patient from, like, say, in Arizona and the patient's in Hawaii or Florida, where I don't have a license to practice, you may be practicing without a license. No, you will be practicing without a license. And that is not a good thing. Not only are you breaking the law, you most likely don't have medical malpractice coverage in case of adverse action, adverse reaction, situation that may happen with the patient. It's something that happens every single day in our practices, these seemingly innocuous requests for medication refills that opens you up to a huge, huge amount of liability. And if you are a support staff, you may be looking at the chart saying, well, Dr. Lin prescribed antibiotics for this lady with 12 refills. Now the patient is in Hawaii. I'm just going to help out Dr. Lin and place the call for a medication refill in Hawaii. Well, you, number one, may be impersonating a physician. Number two, probably run afoul of DEA practicing, prescribing medications without a license. So you may be in trouble by doing that. prescription medication refills, I know for a lot of primary care docs, they delegate that to somebody else, like a medical assistant, or even in a urology practice, you may delegate that to someone who's not a qualified health professional, who doesn't have a license to prescribe. You're always taking on a risk when that happens. You better have a very, very clear and comprehensive workflow for that support staff to follow if you are letting him or her refill medications on your behalf, because it may land her in jail and you may be medically liable without any medical malpractice coverage. That is correct. Something as simple as prescription refills or sending a prescription to a place that is not in a state where you are licensed to practice, you are not going to be covered by medical malpractice, and you would be in breach of statute. And for any person in your practice who doesn't have a DEA license to prescribe, if she were to call in that prescription, in all 50 states, it is illegal to impersonate a physician. So if you are a support staff and you don't have clear guidance on when you can refill a medication, and especially in instances where the patient is not in the state where your physician is licensed to practice, you better think twice before you refill that prescription or call in that prescription. I know you probably mean very well. You want to try to help out the doctor, try to minimize his or her workflow, but please be careful. That is all I'm saying. All right, as usual, if you have any comments or questions, leave them below. I look forward to interacting with everyone. As always, I thank you for the privilege of your time. Please take care of yourself and take care of each other. Bye-bye.